Opportunity to comment on this again, hashtag full view. On to other news now. President Cyril Ramaphosa has met with members of the Secretariat and the leads of the working groups of the Commission on Africa's COVID-19 response strategy to discuss progress made by the expert panel since its inaugural meeting on the 22nd of June this year. A panel of health experts forming the Commission has been working to meet its twofold mandate, which is firstly to identify gaps in the continental COVID-19 response strategy and propose evidence-based interventions, and to also generate evidence to assess the impact of COVID-19 on social and economic harm on the continent and propose ways for a strong recovery. To speak about this, we welcome Dr. Lwazi Manzi, who's Secretariat of AU Commission on Africa's COVID-19 response. Welcome, Lwazi. Thank you so much for speaking to us. So, what have been the difficulties since you've been on board that have faced Africa, especially in a multilateral context on COVID-19?
Thank you so much for having me, Tsepiso. So absolutely, in working with the health experts in the Commission on COVID-19, as you have correctly said, one of the mandates was to specifically look at the COVID-19 response in the region currently and to assess the gaps and really to support His Excellency in his role as the AU champion on COVID-19, which is a very strategic role in which he can intervene in areas where the strategy can really be uplifted and moved forward to respond adequately to the COVID-19 pandemic on the continent. Now, some of the issues that we saw, were really affecting the continent was firstly with diagnostics and therapeutics. We know, for instance, or let's start with vaccines. We know, for instance, that 5% of the population has been vaccinated on the continent, and we are seeing growing inequity in terms of low and middle income countries being able to access vaccines and high income countries being able to access vaccines to the extent that they are now rolling out a booster shot program. So that is obviously an exceptionally great challenge, which leads to then the second challenge, which is on diagnostics and therapeutics, in that with the slow rollout of vaccines, we know that we are very likely to then see subsequent waves of the pandemic. And yet, and this is in the context of a region that is still battling to keep up with the WHO living guideline and really get in those new therapies, to the extent that we are able to actually get them to the people who actually need them. We still have an oxygen shortage. We still struggle to coordinate information, gather intelligence in a centralized manner so that we can really act quickly when we see that there is a resurgence. So these are areas that we are looking into as a commission, and the health experts in turn wanting to intervene on.
So then, tell me about this initiative that the experts have introduced, APRA, the African Pandemic Preparedness and Response Authority and Fund. What has been its impact in capacitating the continent, but most especially for future pandemics?
Right. So we met with His Excellency only last week, Wednesday, and the concept of APRA was actually introduced to him only then. And this is a concept that still needs to actually undergo a very robust program of consultation, but firstly with member states, and then of course with across the stakeholders, including civil society and communities. But let me just say that if we look at the president's tenure when he was the chair of the AU and the initiatives that he started, firstly, if we look at it, he established the joint continental strategy, and in doing so uplifted the Africa CDC and really made it an authority in the region. He established the AMSP, he established AVIT. And if you look at all of these initiatives, they were all initiatives that really focused on the regional ability to combat COVID-19. So the health experts then looked at this because really they're mandated to really look at what the response has been and to push whatever the president actually initiated and push it into the future and ensure that there is adequate preparation and adequate response to the future. Okay. And they therefore took cue from actually looking at that response and said, well, we really need to, first of all, institutionalize these initiatives, and secondly, then ensure that there is really, really good coordination with what we already have.
Lwazi, before we run out of time, as you're going through these strategic areas, I want to talk about positioning the continent as an attractive health investment destination. We know only about, 10 sites or 10 countries are involved in the manufacturing of vaccines. So how are we going to woo investors over?
Absolutely. So there's two aspects to it. So first of all, it's to really push that manufacturing agenda and push African products, firstly, within the region. As you know, with the Partnership on Africa Vaccine Manufacturing, they have a target to produce 60% of Africa's vaccine needs in Africa for Africa. We want to extend that mandate to say, well, for Africa to be able to mount an adequate response, we need to push manufacturing to that level for African products to actually be used in Africa. So the first aspect is to mobilize the governments as well as those who spend on health to actually spend on African products. Then the second part of it is to then attract that investment, particularly from private investment and from private capital, to attract it into the region, to also drive that manufacturing agenda and to position the continent as a place where we are actually manufacturing biotech, good quality biotech that has been quality assured through very robust regulatory systems.
All right. Hopefully next time we'll have more time to discuss that. Thank you so much, Dr. Lwazi Manzi, Head of Secretariat at the AU Commission on COVID-19, telling us about the progress that has been made. Francis?